Hello, I'm Randy Swallow. Welcome to COVID Conversations. COVID Conversations will address common questions, concerns, and myths about coronavirus, vaccines, masks, and much more. This forum brings together a blue ribbon panel of healthcare professionals, a pair of county commissioners, and a COVID-19 survivor who will talk about his experience with the virus. First, let's start with Clark County Commission Chair, Marilyn Kirkpatrick. Commissioner?
Hello, and thank you for having us here today. And I really hope that so many people around Clark County will hear from folks here in Clark County on what we're experiencing in our community. So I welcome everybody. I look forward to getting all of your questions answered and give you the information to help you make the decisions that you want.
Commissioner Jones?
Thanks, Randy. I really appreciate the opportunity to be here today. I appreciate all those who are participating and watching online, and to our panelists here, so we can really have that conversation that will lead folks to get the vaccination. That's what we need to keep our community safe and viable.
Let's talk first to Frankie Rivero. Thank you so much for joining us, Frankie. You're 30 years old. You look to be a very physically fit individual. And yet, a couple months ago, COVID really upended your life. Tell us your experience with the coronavirus.
Yeah, so back in late June, I woke up one morning feeling a little odd, minor body aches. Didn't think too much of it. Figured just due to exhaustion, due to a busy work schedule. The following day, I didn't feel any better, so I thought just to be safe, let me go get tested. And sure enough, tested positive. After it was confirmed that I was positive, I still had a fairly optimistic outlook on it and figured because I'm young, I'm fairly healthy and whatnot, it'll be a few days and I'll be back to normal. On the 5th day, I woke up just unable to breathe at all. I couldn't get out of bed to shower, cook, do anything, and that's when I decided to check myself into the hospital. And it's a good thing I did. As soon as I got there, they confirmed that I had pneumonia on top of the COVID. And I spent 5 days in the hospital, which was fairly difficult. Being in a room, the same room for 5 days straight, takes a toll on you. After I was released from the hospital, spent another week isolated, just in my apartment. And again, that takes a toll on you because you're away from family members, friends, have very little contact with them other than FaceTime, but even then you want to limit those FaceTime because you don't want them to see you in the condition that you're in. So again, obviously it takes a physical toll on you, but a mental toll as well.
How are you feeling now, Frankie?
I'm feeling better. However, I'm still working on getting back to where I was pre-COVID, as far as my strength goes, conditioning and whatnot. So it definitely took a huge hit on me in that aspect.
Let's talk to some of our folks from UMC. Vanessa Woody, UMC registered nurse, and Dr. Luis Medina Garcia, UMC infectious disease specialist. Both of you have been on the front line since day one, a year and a half ago or so, treating people like Frankie and dealing with his families and other COVID patients. Talk a little bit, if you would, about your experiences with that.
Yeah, as a nurse, just walking onto the unit and driving on your way to your floor, it's a scary thought. No one realizes how scary it is. You hope and you pray that your patient that you have today, that they will be okay, that you're not going to have to call a rapid response, and you hope and pray that they can get better. And sometimes it's not the case. Sometimes you do have to upgrade this patient. And just in my 5 years of being a nurse, I've upgraded a patient and called a rapid response on more patients in the past year than I have in my entire career. And it's terrifying to just not know the progression of the illness and to be just trying to hope for the best and trying everything you can. You really have to bring it to the next level as a nurse and to be vigilant in caring for these patients. And like Frankie said, you don't think of the other side of it, in that if your family member's in the hospital, you can't go and visit, you can't be there and support. So a lot of these patients are alone, and we are the ones who are supporting. And no one wants to be away from their family member when they're sick. So that's been hard on a lot of people, and just the struggle emotionally for the patients too, to know where they were and where they are now. It's scary times in the field of healthcare.
Dr. Medina Garcia?
Thank you. Thank you, Vanessa, for sharing that. And thank you for being right there next to the patient. As an infectious disease doctor, this is the most challenging infection that I've had to deal with in my professional career. Adding to that, the technical challenge of caring for these patients and the emotional challenge of taking care of these patients is unbearable. And the reason for that is, as a doctor, you kind of have an expectation of how patients will do when they come into the hospital, right? Somebody comes in for pneumonia, regular community-acquired pneumonia. Most patients do fine. You give them treatment, and you can see them getting better right before your eyes. And COVID is capricious. COVID is tricky. They come into the hospital, they feel bad. You start giving them all the treatment that we have available. You get your hopes up, and then suddenly they can fall off a cliff without any warning. And so it's really challenging for us because the treatments that we have available are just not good enough to prevent the progression of disease and to really steer those patients towards getting better and getting discharged. And when dealing with the families, it's also very difficult because the perennial question is always, how's my family member doing? And you call the doctor every day and you get a report and they tell you, the residents call and they tell you, and they're doing well today, and then suddenly things take a turn for the worse. And having to explain to patients' families, how they were doing so well and suddenly, they just took a turn for the worse is extremely difficult. What we know also is, that vaccines are incredible tools now that prevent the progression of disease. We take a lot of x-rays and you look at how bad the lungs are doing, and there's been a lot of published cases recently where they compare two patients that got infection with COVID. One of them was vaccinated and the x-ray of the chest is largely clear, and you can see the huge differences between the unvaccinated and the vaccinated. And so really the best fight is the one that you don't get into. We will always be there for patients. We will always be there to support you. But, help us take care of you. Help us to avoid a tragedy.
Dr. Jose Maria, Partida Corona Medical Center. How have your experiences? Have they been similar to what we've seen at the hospital?
Well, my experience has been largely outpatient. I have a clinic in the Valley, and the day that we initiated the shutdown, we went from seeing basically 100% of patients in person to seeing 100% of them via e-visit. And let me tell you, that was a nightmare in and of itself. But we quickly ramped up doing COVID testing at my office. In fact, a couple of days we tested, I think, around 150 patients in one day, which is crazy considering I'm a one-man practice. But fortunately, I had a lot of good staff that was willing to step up, and that made the difference. As far as the experience with the patients themselves, the frustrating part is that we have very few medicines that make any bit of difference on the outpatient side. They're very ineffectual. Hydroxychloroquine, ivermectin, you name it, they may help a little bit, but it's not going to be nearly enough. And so it's hard to see these patients fall ill, especially now that we have a vaccine. There's one very telling stat that I actually got from the CDC. Of the people that have died from COVID that were vaccinated, there was only 1,263 people that were vaccinated and died from COVID. That said, we're now past 610,000 unvaccinated. So I think that speaks volumes to how effective the vaccine is and why we should get it.
Dr. Ferman Ligan, with Southern Nevada Health District, the vaccination, as we see, get the vax, obviously is the message that we've been trying to get across. What side effects are there, or that what people are thinking side effects may or may not be there from the vaccine?
Well, I mean, those vaccines has a similar side effect that most vaccines that are used in the regular immunization schedule. I talk about the most common side effects, like pain on the site of infection, which is very common. Also, people might have muscular pains. Some might present some weakness. Some people actually might faint immediately after vaccination, and that's why the recommendation is to observe the person at least 15 minutes immediately after vaccination, or up to 30 minutes if the person has any history of allergies to vaccines. Those in general are the most common. Some people might present mild fever, headache. Those are in general the most common. There are other, I would say, more rare events like have been reported, like in recent weeks there was a report of myocarditis in younger people, but this is considered a rare event. It's like 1 in a million vaccinated people.
Mason Van Helling, the Chief Executive Officer, University Medical Center. Hospital capacity obviously has been affected, and that's one of the measurements, one of the yardsticks we've been using, obviously, as this pandemic has spread. Tell us up to date where we are right now with hospital capacity at UMC, how that's changed or fluctuated in the past year and a half.
Sure, and that's a great question, and Frankie is, as you mentioned, looks extremely healthy, fit, young, but not unusual what we're seeing currently in the hospitals. So at UMC, typically this period of time is our slower period of time. We usually get a break in healthcare, right, Vanessa, Dr. Medina? But we've not seen that in the last 18 months. The healthcare system is strained currently in Clark County. 1 in 4 patients that are in our hospitals are COVID positive. When you look at our staff beds and our licensed beds, that's what we're seeing. And as it was alluded to, well over 90% of those at UMC, 97% of those are unvaccinated. Those that are in the hospital typically do have those underlying conditions, a vulnerable population, but it certainly is trying times for us. We've been on full speed and overtime since the beginning, and it's long hours and long days, but we're honored to take care of those patients. But many of these admissions to the hospital can be avoided by getting the vaccine. We're seeing it today. We've seen the population age come down dramatically. The death rate has slowed dramatically, and the ventilator use has slowed because of the vaccine. But we need to make sure we get the word out, and it is extremely safe, the best vaccine we've ever seen in our history. But we need everybody's help. As Frankie, the length of stay for COVID patients is twice as long as the average patient that we've historically seen. So as you mentioned, not only in the hospital longer, but also some of those issues of not being able to see friends and family can all be avoided with getting the vaccine and minimizing those symptoms and acuity.
I've said for the past year and a half, most people didn't even know what an epidemiologist was, and now it seems like everybody is one, right? There's so much misinformation that goes out there. Let me throw a couple to our medical experts here. Facts or myth? Is it true that most COVID deaths or hospitalizations now occur in the United States or Clark County are among unvaccinated people?
And so for COVID-related, that's definitely in the unvaccinated population. And patients that are vaccinated rarely end up in the hospital. We tend to see those that are vaccinated that end up in the hospital is those that have immune-compromising conditions, so transplant patients, patients that are on immune-suppressive drugs for other diseases. But by and large, deaths due to COVID in this Clark County are in unvaccinated folks.
COVID-19 vaccines don't work and are experimental at best.
Well, I mean, the concern out there in the community, especially at the beginning of the campaign, was like, how fast those vaccines were manufactured. It's the first time in history that a vaccine is created that fast. But we also know that technology is improving every single day. And in addition to that, there was a lot of money put into vaccine development just for this particular purpose. We are talking about billions and billions of dollars that government put up front just to promote the development of those vaccines. So it really created an environment where scientists were able to work and develop the vaccines. Now, before the vaccines were offered to the community, they were submitted to traditional processes, and the vaccines were approved once the FDA and the CDC were sure that the vaccine was safe and also that were protective. That was after the phase 3 of the field testing. So those vaccines have been demonstrated that are safe and are protective. And right now we are 9 months after the initial deployment of the vaccine, and we have millions of people vaccinated in the United States and millions of people vaccinated across the world from either Pfizer, Moderna, or Johnson & Johnson. And so far, the data shows that those vaccines are secure.
And if I could just add something to that, in my opinion, these vaccines are the biggest advancement in healthcare in our generation for sure. And they're the result of unparalleled and unprecedented collaboration over the globe. I mean, think about it. The entire community of the world understood that this could wipe us out. And they put their differences aside, and they started working together, and they streamlined every single process possible to make this happen. And at this point, there's no question of whether these vaccines are effective. They save lives. And we see it every day in the hospital, and you could see it in the news across the world. And so we're in a privileged position. Let's take advantage of that.
One thing that I'd like to add there is the cynic in a lot of us says, it was too rushed because there were billions of dollars invested. And they compare it to other vaccines and how long it takes to roll them out. Well, unlike, say, a vaccine for chickenpox or yet another vaccine for polio, we're not in a chickenpox or polio pandemic. So COVID got our attention in a big way. And that's why a lot of these companies aren't having to deal with the normal bureaucracy that they would normally find in developing these vaccines. What's more, there are several companies that have yet to make the market with their vaccines. Novavax isn't out yet. AstraZeneca isn't available here. So not all vaccines got approved. So that should tell you something as to whether or not they just opened the doors to any old vaccine or if it was actually tested. And you've got to consider that one of the main ways that Operation Warp Speed facilitated the production of these vaccines is they paid basically upfront to all these companies the money that they needed for manufacturing and distribution. So those manufacturing and distribution parts of the process were already being done at the same time that these phase 1, phase 2, and phase 3 trials were doing. So instead of it being chronologic, it was all pretty much at the same time. That's why it got out there faster.
COVID-19 vaccines cause sterilization and long-term health problems.
Okay, so during the clinical trials, I believe there were 53 pregnancies, despite the fact that they tried to, in fact, they specifically tell you to avoid pregnancy. So if it's causing sterility, it didn't in those 53 people. Okay? Syncytin-1, which is a placental protein, was supposedly very similar to the spike protein that you see in COVID. And it's the same spike protein that these vaccines basically produce so that our immune system recognizes the coronavirus as foreign. Now, that said, it's equating any spike protein to any other. But that's like saying, for example, these are two keys, right? But which one's my car key? Kind of obvious, right? Same with comparing syncytin-1 to the COVID spike protein. They're very different. And in fact, there have been studies to see whether antibodies recognize syncytin-1 as foreign after COVID infection, and it didn't pan out. So it's erroneous.
COVID-19 vaccines are unsafe for children.
And so, in the development of these vaccines, small children weren't involved at the beginning. And that's usually the case for situations of urgency like this. But the mRNA vaccines that have been developed are running trials in children. The first results of those trials led to the approval of the vaccines in ages 12 and above. Word on the street is that in the next few months, there will be approval for younger patients. In my opinion, these trials are more of a dose type of trial, meaning what dose of the vaccine should we be giving kids to ensure that they get protection, more so than a safety issue, because really it has been widely proven across the world, right? It's a safe vaccine. So we're just waiting for those regulatory steps to come to fruition for the next stage of patients to be eligible to be protected.
COVID-19 vaccines will require booster shots eventually.
Well, there is actually, in recent days, mostly representatives from the manufacturers have been talking about the need for the booster dose. So far, the federal government, neither the CDC or the FDA, have actually make a decision in that regard. They are looking at information based on the follow-up that they do on the level of antibodies on people who have already been vaccinated. And once they make the determination that those levels are below what is needed for a person to respond to the infection, then they might decide that a booster is needed. But at this point, there is not a decision from the federal agencies that this is necessary. It could change tomorrow, but it's not true today.
And I think that's an important thing to highlight, right? We get a lot of questions about, the agencies changing their minds in the recommendations. And to some extent, I think it can erode a little bit of the trust in those organizations. But I want to remind people of the process of science, right? It's not that the science has changed. The scientific process has not changed. It's the fact that now, through time, you have more answers now than what you did a year and a half ago. And so how irresponsible would it be for those recommendations to not change? To say, we know something now that we didn't know before, but we don't want to confuse people, let's just leave it the way it is. And so really, the CDC and the associations that do all this research and make these recommendations at large scale, they're being responsible by telling people, okay, now we know this. This is what we have to do to keep people safe. So trust in the system, trust in the experts that are behind those recommendations, and let's all move forward together.
And I'd add, just highlighting that, like Dr. Medina said, this is a process, and we are going through clinical trials. And I don't know how many people understand that these clinical trials are ongoing. And there's people in our own city who are part of these trials. And They get all of this testing and lab work done and nasal swabs and sputum swabs to assess and reassess the effectiveness of the vaccines, to assess and reassess how long the antibodies are in their blood, and so that we can make those changes and go through that scientific process to adapt, to grow, to do what's best for the population.
We have an online question. Dr. Ligan, you have some fans out there. Can the COVID-19 vaccine cause antibody-dependent enhancement, also known as vaccine-enhanced disease?
Well, actually, the vaccines, they do not cause the disease itself, because when a person is receiving the product, whether it is the ones based on a messenger or the ones based on a vehicle like Johnson & Johnson, these are particles that trigger a response from the body, but they do not reproduce the disease in the person. So there is no way a person will actually develop COVID from those vaccines. Because again, these are not a live virus that is being injected into the person, and also these are not main components of the virus that is being injected into the person.
Commissioner Justin Jones, District F. Here at Clark County, this is becoming a requirement now, will soon be a requirement for vaccinations or for very frequent testing. Why did we do that in Clark County? And do you think this is kind of going to be the template for other public and private businesses in our community?
You know, this is obviously a defining issue in our community right now, right? We have a tourist economy that depends on people feeling safe coming here. And so it's incredibly important that we make sure that we are providing that safe situation here in Las Vegas for people to come here and for our own folks who live here. And so Clark County wanted to make sure that we were leading by example. And so at our meeting last week, we on the County Commission voted to move forward with the policy of requiring vaccination or regular testing for our own employees. We've already seen other organizations moving in that direction. Certainly some of the strip properties were already there, MGM and other organizations. And today, Life is Beautiful announced that they're going to go that way for their upcoming festival. And I think you're going to hear more and more of these companies, these organizations, they're going to be moving in the direction of not only caring for their own employees' health and safety, but for their customers.
Large sporting events and other large gatherings, public gatherings, then? Would that be included? Would that be included?
Yeah, no, I think you're going to see that. I know that there will be additional announcements here in the next couple of weeks because, again, we want to make sure that people feel safe. And we have to cater to those who have made the decision to be vaccinated and not to those who refuse to get vaccinated.
Let's talk a little bit about masks, panel here. And again, fact or fiction, I think we all are getting more used to these now, perhaps not as polarizing as vaccines, but masks aren't proven to be effective and they restrict oxygen flow.
If I can, at the beginning of the pandemic, there was that question of whether they would restrict your oxygen levels. They actually studied that, and they found out that it doesn't. As to whether masks help, they absolutely help. They absolutely work. They just recently published 2 large studies out of Spain where they did concerts with 5,000 attendants. And the transmission between those concert attendants was minimal at best. And when they actually did the contact tracing afterwards, which is the public health specialist making calls to the people that you were in contact with to find out how you got it, it turns out that of that 5% of people that got infected that went to that concert, 2.5%, so half of those infections actually happened before the concert. And so we know that it works. They're inconvenient, sometimes uncomfortable, but it's definitely something to keep doing.
And so many parents are obviously very concerned about their children, rightly so, and many of them say that masks shouldn't be worn or aren't safe for children over 2 years old. What do we say about that, panel?
Honestly, I think the parents are more traumatized than the kids are. I have a 3-year-old, I have a 5-year-old. When I take them to school, we put our masks on. It's simply not that big of a deal. They really don't care about it one way or the other. And they will follow our lead. And if you really think about it, they're the most vulnerable populace right now because vaccinations aren't available to them. So if you want them to go back to school, what other choice do you have to protect them? And you also have to keep in mind that by them masking up, it's not just about protecting them from getting an infection, but if they have the infection, preventing them from passing it to other people. In fact, that's really how masks help. It's not about everyone. How can I put it? It only takes one person to contaminate everyone else, and if that one person isn't masked, that's the risk.
And
So it's just a simple matter of, are you going to be considerate about everyone else or not?
and it's good citizenship, looking out for each other.
Yeah, Randy, if I could too, and usually the hospital numbers are kind of lagging behind whether we're in mask or not. And this group and many others have been studying this since the beginning. And with a positivity rate that we have currently, it's the one way and getting vaccinated to slow down these numbers. And again, we think it's the right thing to do, and getting vaccinated will help, as Commissioner Jones said, protect those that are visiting us, protect our families, our loved ones, and keep people out of the hospital. And so that's what we're hoping for, Commissioner Kirkpatrick, is with the mask, continue to bring down the positivity rate so we can get back to normal business again.
Commissioner Kirkpatrick, that's pretty much where we are? I mean, is it conceivable that masks could be mandated, that shutdowns could happen again in our community?
I would tell you that absolutely. I would much rather wear a mask to avoid shutdown. And many of the constituents that we've talked to around Clark County agree with that. And it really is important that we come together as a community and listen to the experts that are here today. This is boots on the ground in Clark County. This is what's happening to us. And that we wear a mask because we don't want to shut down. We can't afford to shut down. And we as a community are better than that.
And if I could add, from the healthcare point of view, we gown up and put on a mask and we're N95 and sometimes double masks for 12 hours at a time, sometimes longer. And yeah, sometimes it's a little difficult to breathe, but we're still able to get oxygen. We're still able to do our job to care for our loved ones. So in asking people to wear masks, that's the least I think people could do to help us and those who are at the front lines fighting and battling and having to wear these masks. And I've had days where I've came home and I've had indentations on my face and lines on my face from having my mask tight because I'm trying to protect myself and my family. So masks, it is possible. You are getting oxygen by wearing them. And I saw this picture and it's a little funny, and I think sometimes we have to put it in simple terms, and it describes masks and the benefits, and that when I wear a mask, it's like someone who's wearing clothes and they're peeing on themselves. If I'm wearing a mask, I'm with someone else, and so if I'm wearing clothes and I pee and someone else is wearing clothes, then they're protected. But if we don't have clothes, then someone else will get wet. So same kind of story, that if I wear a mask, it protects me, and if someone else is wearing a mask, it's protecting me and them and those around us.
Dr. Ligan, on the Southern Nevada Health District's campus on Decatur, you have the Southern Nevada Community Health Center. That's available to a certain segment of people that can certainly use your assistance. Tell me about that location.
Right, thank you. Well, the Southern Nevada Community Health Center is a federal qualified health center. This is a center that offers primary care services, meaning medical services for adults, children, pregnant women as well, and also is a center that offers services based on the level of income of the family. So, and this is something that is a standard for all community health centers across the country, and there are other community health centers here in Clark County as well. All those community health centers offer those services where the person is charged according to the family income. So families who are, with a low level of income, they actually might even receive a free service if they are unable to pay. And everybody receives the medical service, the care they need, regardless of ability to pay.
We'll just go down with our final thoughts here. And Frankie, I certainly didn't mean to exclude you, but if you would, just tell us where we are. Give us your final thoughts on COVID vaccinations and everything that you've gone through.
Yeah, I'd say the average person in our community, like myself, obviously have different thought process than our health officials. I would say refrain from making naive assumptions. Like myself, I think, like I said, the average person, we see things on social media, on the news, and we stick to whatever resonates with our beliefs and completely disregard other information, which obviously is detrimental. It's important to respect other people's thoughts on it, but also to be mindful of how we have direct influence over one another, and like was mentioned earlier, just to be considerate of one another. So,
Dr. Leggett?
Well, thank you. Well, actually, when we started today, I was talking to Frankie, and I told him that to me, he's the most important person in this room, and he thought I was kind of joking, and it's true, because his experience is his personal experience, is a reality, and it's something that anyone who listens to that experience can relate to. We are professionals, we are trying to deliver a professional message to the community, but I believe that the strongest message that could be out of here today is the message that Frankie is delivering to the community. So that's why I say that to him.
Dr. Partida Corona, give us your final thoughts, please.
Couple of things. One, and this is more for my fellow medical colleagues. One of the things that I've run into is just frustration because we see something that's avoidable, and that's what makes it really tragic when we see these unvaccinated people succumb to the illness. But remember, when you have a patient that's vaccine hesitant, that these are our friends, our neighbors, our siblings, and it's just a matter of having patience enough to explain to them what it is that we're seeing and why it's important. And I know that can be really hard, but that's the way that we're going to change minds, is just one conversation at a time. As for the general public, none of us want another lockdown. All of us want to see the economy bounce back and so forth. But that's never going to happen so long as we're seeing a lot of people die of this disease. And we already know how to get out of that. It's vaccination. It's that simple.
Mr. Van Hollen?
Yeah, I think, as mentioned, we're a lot farther along than we were 12 months ago, and we do have many answers to this. So if those are still on the fence, please reach out to your physician, Southern Nevada Health District, UMC. We'll be glad to answer any questions, help you get the vaccine and the services. But again, you don't want to end in the hospital. I mean, Frankie could tell you he'd rather be at other places than in the hospital, but it's totally avoidable. But we just need everybody's help, and we can do this together.
Nurse Vanessa.
I've had so many conversations with different patients who hindsight said, I wish I could have got the vaccine. And at that point, it's too late. And I can't tell someone that they need to go get the vaccine right now. That's a decision for them to make for themselves. But they need to look at the evidence. And I'm not speaking about something that I wouldn't already do, that I haven't already done. And for myself, I as an immunocompromised person, that was a decision I had to think about and pray on and decide that this is what's best for me, because I would rather get this vaccination and have some minor side effects than to see and end up in a bed or intubated with a tube down my throat or even worse, death. And so just from seeing the experiences in the hospital, that gave me peace about it. And so I think, like Mason said, that if you're not sure, ask someone who's reputable. Don't go and look online. Seek out those resources, because there's a lot of false information out there. And so seek someone, ask those questions, and to help guide you towards that right direction that you need to make.
Dr. Medina Garcia.
Well, first of all, thank you for having us. I'd like to tell people that the most important reason to get the vaccine is out of love. Love for yourself, love for those that you care about, love for your community, love for your country. Last year, they called healthcare workers heroes. We do it because we have to, because we make an oath. But this year, it's your turn to put on your cape. Do what you need to do to help us move forward.
Commissioner Justin Jones.
Thanks, Randy. My son Liam started back at school this week, and he was very excited to get back in the classroom. He's 11, and he has asthma, and he can't get the vaccine. I have good friends who are just now getting back to work on the Strip and are so excited to be able to get back and do the things that they love, get in there for the live shows. My friend Mike was supposed to go through cancer treatment, and he was told that he couldn't because the hospitals are so full. Please, get the vaccine for the Liams so we can keep our schools open. Get it for all those who are on the Strip and are just trying to work. Do it for the Mikes out there who need treatment in our hospitals and can't because we have so many COVID patients. Do it for them, please.
Commissioner Chair Marilyn Kirkpatrick.
Thank you. And first of all, I want to say thank you to all of my colleagues up here. They've been working for the last 17 months, a minimum of 12 hours a day, 7 days a week, just to protect our own community. And what I would say to the community is please reach out to your physicians, your friends, your family, to see if they've gotten the vaccine, if they need more information, and help them make that choice. And know that as a community, we can only go ahead if we all do this together. We're so close, we've worked so hard, and we have so many people to thank. And I just know that our community can come together to finish this off so that we can have our lives back for the long term.
Thank you, everyone. We sure appreciate you being here. We really do.
Thank you.
Thanks to all of our guests. If you're watching this and you want to get the vax tonight, you're in luck. A drive-through vaccination site outside of UNLV's Stan Fulton building is open from 5:30 to 10:30 Sunday through Thursday nights. Other vaccination and testing locations are available on the Southern Nevada Health District's website at snhd.info/COVID. The state of Nevada's bilingual vaccine hotline operates from 7 a.m. to 8 p.m. daily. Call 800-401-0946. Thanks for watching COVID Conversations. I'm Randy Swallow. Good evening.